Hello everybody, today I'm with Jaretta. Jaretta is a subscriber to Lost in Phoenix. She commented that she was a nurse here in the Valley at a local hospital, and I invited her to talk so that she can share her experience, what she's seen at the hospital, right? And so Jaretta, when I talk to these folks, I interview these folks out in the streets, you see them later on, right? After they've, OD'd, after they get ill. What are you seeing at the front lines at the hospital?
So I'm a critical care nurse, so I see the worst of the worst after these people go down. Most of our patients at the hospital that I work at, many of them, I would say like 60 to 70% of our patient population is hooked on opiates and amphetamines, is positive in their urine. They have lots of different ailments. Meth is a great cardiovascular killer. It causes massive heart failure for these people. So people can be like 20 or 30 years old and have a ejection fraction of their heart that is 10 to 15%, which is not viable with life. A normal ejection fraction is 55, 60. And a lot of these people are working with 10 to 15% after they have done meth use. It doesn't even take that long, especially in Phoenix. Being dehydrated out on the streets is going to, cause problems with your cardiovascular system. And then you add methamphetamine to it, and the heart pounds very fast and very hard because meth speeds everything up, and the heart just fails. And these people go down. And you can never get that back. You can never stop meth and, come back and say, okay, I'm gonna not be a drug user and I'm gonna heal my heart. It will never happen. You'll always have heart failure. That's another reason why, these people, when they're, in little tiffs outside or wrestling with the police or something, a lot of them go into cardiac arrest. That's one of the reasons why dehydration and heart failure or cardiovascular disease is very common with the drug users right now, especially if they have a history of meth or cocaine. It's pretty rare. Most people are doing meth, amphetamines, and opiates right now. And then the opiate pandemic, most of our patients are on opiates. Very, very bad. These people out on the streets come in with massive infections. Some of them inject the drug, so they have like sores all over their legs, and they get really bad infections. And I'm talking like antibiotic resistant infections. So these IV antibiotics that they're getting, we're infusing them, and the bacteria is so resistant because these are like super bugs. And plus these people, sometimes the infection goes clear into their bone. They'll need amputations. They lose their legs. This is, it's pure human suffering. And then also with the opiate users, they're causing a lot of antibiotic resistance among our population by coming into the hospital. They get found down. The ambulance brings them. We start them on IV antibiotics because they have these horrible infections that are causing them to go septic, and then they're causing antibiotic resistance because they never heal that bacteria that's in their blood. And they leave against medical advice. They never finish the course of IV antibiotics or even oral antibiotics, causing our bacteria that's harming us to get even stronger and stronger. And it's definitely getting stronger in their body because it's causing them to have a super bug. So it's just getting worse and worse. These infections go through their bloodstream. They cause clots in the heart, which shoot up to the brain, giving them strokes, causing them to be bedbound. It's a quick loss of life. These people, right now, how bad these drugs are, their life expectancy is just, I've had hospice patients, 20, 30, or either that they try to leave AMA and they're so mad because they want to go out and use drugs from the hospital. They try to get up and go out the door and they die in the parking lot. They want the drugs so bad. So the hospitals are full of this pandemic. I would call it a pandemic, not just a problem at this point.
And so the people that I interview, they call these pills blues. It's more like counterfeit fentanyl pills, fentanyl is used by doctors to help with the pain management for cancer patients. Is that correct?
It is. It's used as an IV medication or as patches. They can use it in anesthesia care, hospice patients that are dying. Sometimes we'll give fentanyl to severe pain, but I don't think it would ever be enough. Even our medical grade fentanyl is never enough for these people in the hospital. I don't care if I gave them some fentanyl for pain, they would be out the door ready to get their own. It wouldn't matter. Like these people come in and they're in lots of pain. I mean, once you sober up and your body's full of infection and swelling and cellulitis and heart failure, you're in a lot of pain. These people are basically hospice patients. It's really sad. So the fact that art is showing the public what is going on is really important, because prevention is better than ever becoming addicted. I really pray for these addicted people because they're in suffering.
And have you seen a shift to like younger people being admitted to the hospital that you're seeing? That's the shift that I'm seeing when I go out to the street, just younger and younger.
Yeah, so my hospital is adults only. Like we do take peds into the ED, but we usually transfer them to a pediatric care. So, but we do have a lot of people come in through the ED that are young. My patients are young. They're in their 20s with heart failure. I think that's a kid still, I think that's still a kid to me. 20s, early 30s,
But that's not normal
It's
for
not
have
normal.
heart failure at 20.
No, it's not normal at all. I mean, heart failure in your typical, I see 90-year-olds that don't have heart failure and have had lots of cardiovascular disease issues, and they don't have heart failure. They have hypertension and diabetes and the whole 9 yards of cardiac, issues, and they don't have heart failure. But the patients that are coming in have failing hearts, failing organs if they OD. These people, they get found down on the concrete, and then they come in with massive burns all over their body from, Phoenix is hot, the pavement is hot, and they get found down, and their whole back or wherever they were laying will just be 3rd-degree burns and blisters on top of all the other issues that they have, and then more infection exposure. The list really never ends for how sick you can be on these drugs. So
It's really unfortunate to hear you explain all that. I see it at the street level. You're seeing it at the hospital level, and I agree with you, right? Absolutely. You're familiar with Blake.
yes.
Underlying medical issues, refusing medical treatment because of his addiction.
Yes.
So let me ask you, what can a citizen do that's driving by and they see a person like Blake that's obviously ill, and they want to do something, right? They want, hey, I want to do something for that. He looks ill, right?
Yes.
And can they call 911? Yes, we know they can call 911. But what happens after they call 911 and a police officer goes, or an ambulance is called, an ambulance goes? What happens next?
Yeah, so I understand that, we're all humans and we want to help people. Even myself, I would take myself when I'm driving around, I don't feel like a nurse. So like if I saw someone like Blake, I'd be like, I'm going to call the ambulance, because that's just what I do, because that person, it looks like they're going to not do so well in the very near future. Nursing kind of leaves my body when I get out driving and on the streets for some reason, so I would do the same thing. But there are laws that if someone is alert and oriented and they know their name and their surroundings and their situation and what year it is, for example, and the fire department gets there and they are, refusing treatment, then that person is allowed to refuse treatment. I don't care how sick they look. If they can still talk and acknowledge that they know their situation and their name, that's it. The fire department cannot do anything. So that's that. But what will happen with many people like Blake, they get found down and they're not responsive and they're lethargic, maybe mumbling some words or just not really knowing what's going on in that lethargic, passed out, coherent state. then the fire department can transport them to the nearest hospital and they can get treatment. And then we do our best, once they get admitted, we do our best to convince them, you know, with all the medical issues, like for instance, someone like Blake, our doctors would try really hard and the nurses would try really hard to explain his medical condition to him and that his life matters and that he can get treatment or this, and this could help him. We have these resources and we try really hard. That's like my whole shift is just trying to get these people to stay in the hospital and not leave. And then you have all your other patients, like the 90-year-old that's confused jumping out of bed, and then you have these people. So it's really hard to manage in the hospital because the nursing staff and the doctors were also over ratio due to this drug pandemic, I would call it as well. Having 20 and 30-year-olds is not the typical medical patient you expect to have. So we're bombarded by these patients too, and our older population. So balancing all that's very hard. We try to spend time with them and tell them, that, do this, and this will help your health condition. And then when you leave here, basically you'll be clean when you leave here. So then you can go to treatment, and we try to give them, we have social services at the hospital that come give them resources and talk to them. We try our best. We cannot force them to go into treatment after they're sober in the hospital. Let's just say they stay and they become clean at the hospital during their stay getting treatment. We cannot force them to leave and go to a treatment center. They're usually just going back out, and unfortunately we're getting them a bus pass and they're back out on the streets. So like we healed their infection. Let's just say they stay. We healed their infection, we helped them, we got them IV antibiotics, we got them resources, and then we get them a bus pass, and that's it. And then they are back. We have some patients that come back, like I'll be like, oh, that's my patient again. I know that person. I had him last month, or I had her last month, or she's back. Or you'll read in the notes, like patient been to hospital 3 times in the last week, different hospitals, found down, found unresponsive, so.
Thank you for clearing that up.
Yeah.
And what it sounds like is that our resources are stretched thin with what happened with COVID recently,
Yes.
right? And now with this epidemic / pandemic, opioid abuse, it's flooding our country with these counterfeit pills.
Yes.
And these young people are, passing away. I went to a funeral in May for a 22-year-old gal, Gabby, right? We have somebody like Blake who's ill, underlying medical issues, and then you throw on top of that
Yeah.
these pills.
It
Definitely not good.
does not work out well.
Recipe for disaster, right?
Yes.
And how is our system, our hospital system, able to keep pace with that?
Barely. I was full-time, and then after COVID, I had a lot of PTSD, and I took some time off. I went as needed, so I'm usually working like 2 days at the hospital per week, and then I have another job in cosmetics. I had to take a break and I had to take a step back, but no, we're not. Arizona, our resources are stretched so thin at this point, and part of this drug pandemic is part of it. The fire department, the police, the nurses, the doctors, everybody moving to the state of Arizona all in the last 2 years to flee wherever, California, whatever states were, people weren't happy with the last 2 years. And then now the drugs. Now we have masses and masses of drugs everywhere. I mean, these drugs are accessible to everyone. I mean, young kids, we see them in the hospital just pouring out of people's bags. Like, they're like candy. They're everywhere, literally. I mean, I'm not even a drug addict, and I can literally tell you that they are everywhere too.
Your dog almost ate one.
Yes, I used to live in the avenues in Phoenix, and I was walking my dog, and they see tinfoil, and they're like, oh, yay, some chicken or something. And then, no, it was a melted pill on there, a melted pill on the ground stuck to the foil.
You're so lucky he didn't swallow that. He would.
Yes.
You already know what would happen, right?
Well,
would've
my
been-
nursing instinct would have kicked in.
Right, to
But,
try to save him.
Yeah.
Absolutely.
But, yeah.
Any other advice, any other awareness that the folks that are going to watch this should be aware of? Parents, young people, especially young people.
Yeah.
We want to educate them, let them know that if somebody offers you something, don't take it.
Don't take any of it. I feel like everything could possibly have this opiate, fentanyl, counterfeit Mexican fentanyl coming across the border. It's, this poison. It's a poison. It's everywhere. I've heard, I do not have children, but I've had a lot of mothers tell me about their teenage kids and picking them up from parties, and they were like slumped over in the car, 14, 15 years old. They're just being passed around at parties. I don't know how kids are getting them. I don't think they have to go very far to find them. They're just getting passed around. It's very, very, very dangerous. It's very dangerous. And I feel like this is not something that anybody wants for their children. I see, parents in the hospital with their 20-year-old children once they're found down, and the pain in their face. You can tell they were good parents. They're not scummy people, or they really care, and the pain in their face is just, I'm just getting goosebumps thinking about the parents that come in to their children are bedbound for the rest of their lives, and they're having to make hospice decisions for their 25-year-old, child. Is really hard. And you can be younger than that, you could be older than that. It really doesn't, this drug doesn't have a discriminatory age. It will affect everyone. So I would just prevention for parents. I do live out in the suburbs now, and I think that some people are naive to this pandemic. I'm not, because I work in the hospital. I feel like, we live in a nice neighborhood and my kids are okay and everybody's okay. Prevention for these children, prevention. Anybody that's going through a hard time, adult or child, I feel like they need a lot of support, because there's so many different avenues that people can take and end up on this drug so quickly. It will just take their life, It could be one little slip up. But the problem with this pill, this fentanyl pill, one time, and that's like your hospice call. That's like, I feel like that's the devil's call, for someone, from what I've seen.
Absolutely. I have people out there, they call it the devil's pill,
Yeah.
They're very self-aware. Like they know that what they're doing is wrong.
It is. I see the devil in them when they start to withdraw. You see the fear in their eyes. It's almost non-human. I don't know how to say that and explain it. You'd have to see it to understand it, but I see it in their eyes that they're not who they were anymore. They're not.
These pills are being designed to be very addictive very quickly. The high doesn't last long the way like heroin does. They're being designed on purpose this way, right?
For sure.
There's like a calculated plan behind all of this.
For sure.
So we need to educate the community. The community needs to educate the community.
Yes.
Parents, right? Just because you live out in the suburbs, don't let your guard down.
No.
Right?
No.
It's gonna.
This is depopulating our city faster than COVID ever thought of, let's
Right.
just say.
But isn't that interesting that how many billions of dollars did the federal government give to all the states to combat COVID?
Yes.
But yet this is out here killing people every day.
Left and right.
Nothing.
No, we don't get any support at the hospital. I feel like we should have groups like your group should be able to come into a hospital and meet with people or give resources or hands-on. There's nobody hands-on for these people. We're treating them for infection, and then we're trying to go above and beyond as healthcare workers to educate and tell them that their life is worth it and to do better and you can do it and support them. But after they leave, after I leave and go home, they're, I don't know, they're just gonna have nothing, or they're discharged.
Jaretta, I'm gonna say thank you very much for meeting with me, taking the time to come on down and have a conversation. I really appreciate your time and respect the knowledge and insight that you're able to give the Lost in Phoenix community and the thousands of people who are going to watch this, parents, concerned parents, right?
Yeah.
Because I get contacted by parents regularly saying,
that would be
hey,
my worst nightmare,
Yes.
to be a parent in this
Day and age.
crazy time.
Yeah, absolutely, but with valuable information and insights such as yours, we're able to arm people,
Yes.
give them that knowledge, give them tools to be able
Yes.
to combat this and have conversations with their children at an early age. Stay away from this, stay away from that, because it's all covered. It's all, there's powder.
Yeah.
That powder, they're sprinkling powder
Yeah,
on.
nobody's safe. I don't care what neighborhood you're in, especially if you're living in Arizona. It's literally everywhere. Just keep your baby safe, and prevention. This is really dangerous. There's nothing joking about it. There's nothing fun about it. There's nothing. I mean, this is worse than COVID. I think.
Absolutely. You mentioned you had an episode of PTSD recently, and I just want to tell you to stay healthy.
Yeah.
Please stay
No,
healthy.
I had
Take
to
care
take
of
a
yourself.
step back.
Yep.
Yeah.
Absolutely. It's important for you because you need to be healthy to continue to help
Yeah.
others, right?
Yeah.
So you got to help yourself first.
Yes.
So again, I'm very grateful for you,
Thank you.
and maybe we'll do another session in the future.
Yes.
I'm sure people are going to love this, the information, the insight you're
Okay.
providing.
Yeah.
So again, I'm grateful for you, and I'm very appreciative, and we'll talk soon, okay?
Okay. Thank you.
Thank you.